Hi, my name's Lori Furbush, and this is my strategic video assignment for Business Class 428 with Professor Gary Blackard. I chose a medical device company called Centervention. Centervention was founded in 2010 and was created to provide a comprehensive, hands-on approach to medical device design by working closely with healthcare professionals. Its philosophy and design process are based on years of experience and recognize that every idea has the potential to save lives. Centervention delivers innovative and essential products for medical procedures that reduce cost, contamination, and procedure time. Centervention is setting a new standard in healthcare industry by following strict cleanliness and particle standards. Medical devices are constantly exposed to foreign body contamination in the form of lint and fibers during medical procedures. This lint and fibers become foreign body contamination during interventional and surgical procedures and can result in catastrophic complications, but are not limited to the following: inflammation, thrombus formation, granulomas, embolism, infection, and even death. The risk of infection increases by fewer than 10,000 bacterium when the immune system is distracted by contaminants from foreign bodies. What are the leading culprits in medical procedure complications? It's gauze, cotton surgical towels, and non-adherent pads. Surgical sponges and lap pads are well-documented sources of foreign body contamination. Cotton-based products release lint and fibers that contain cellulose and find their way into the patient. There are 4 ways that lint from cotton products can be introduced. The first one is contact transfer. Gloves and medical devices handled with gauze are placed on drapes in high lint procedure preparation can lead to foreign body contamination. The second one is fluid transfer. Gauze and non-adherent pads are often submerged in fluid to wipe instruments. Lint fibers from materials become immersed in the fluid, which may be drawn up and used for sheath and catheter flushing or to irrigate a wound/incision. The third one is airborne transfer. Standard cotton products readily shed lint into the air, which can then be attracted to gloves or devices or land on the wound or incision. And then the last is direct transfer. When cotton sponges, lap pads, and gauze are placed directly into the wound or incision, they can leave behind microscopic lint and fibers. Additionally, abrasive woven structures of these materials may further traumatize wounds upon removal. What is Centervention's solution? It's by keeping the room out of the patient. Centervention has studied this problem for over 2 decades. They are committed to developing products and promoting techniques that reduce lint and fiber, foreign body contamination, an underappreciated cause of complications, readmissions, and associated cost. By lose the lint. Independent testing proves that our products or Centervention's products have significantly lower particulate count than the leading competitors. Saving the procedure time, Centervention's products absorb and retain fluids better than the current products commonly used in medical procedures. So you can use fewer products overall and have fewer products to count. It helps decrease the cost to the hospital by managing less inventory, saves on shipping, storage space, and cost associated with medical waste disposal. They currently have 3 products on the market that are used. The first one is the Swicker Surgical Foam Sponge. The Swicker is available in a sponge, a digit for a finger, or a mitt that covers the whole hand. It is lint-free, radiopaque surgical sponge that can be used continuously throughout a single procedure to lower the overall sponge count, save procedure time, and reduce medical waste. By using a suction tip on any area of the sponge can be cleared of fluid. It has a biocompatible radiopaque ink dots that provide exceptional visibility under X-ray, and they are also MRI compatible. They can be used as instrument padding for stable retraction, resection, and organ isolation. This reduces the overall sponge count and biohazardous waste expenses. Why should a hospital switch to using a Swicker? They can use only 2 to 3 Swickers per procedure versus 20 to 50 in traditional cotton sponges, counting sponges as procedure time and costly minutes in the OR. Swicker can help teams spend less time counting and searching for lost sponges. They are also cellulose-free. Cotton products made of cellulose can release lint into the body. The Swicker Surgical Foam Sponge avoids complications by lint contamination, reduce room floaters, and clean instruments without leaving any lint behind. The Swicker is available in multiple sizes and thickness to accommodate any procedure and incision size. Why use the Swicker during laparoscopic or robotic procedures? The Swicker can be easily placed and retrieved through a trocar without removing the trocar from the patient. It can be used for resection, wicks away blood to improve visualization, cleans instruments without leaving lint behind, safely clears fluids when using suction devices, and is less abrasive than traditional cotton sponges. A second product that Centervention has is called the Swasher. It's an ultra-lint surgical towel. The Swasher is sterile, biocompatible surgical towel that reduces lint and particulate contamination in interventional and surgical procedures. It has 89% less lint than standard surgical towels. By having less lint than a standard surgical towel, the risk of complications from inflammation, infection, and even death is reduced, which also decreases readmission rates and associated cost. The Swasher absorbs and retains fluids better than standard cotton surgical towels. It is half the weight of a standard cotton surgical towel to save on shipping, storage, and medical waste disposal expenses. It is soft and drapes easily, yet is durable and non-linting. There is also a grab tab which allows for easy opening. The Swasher's features are it is biocompatible, BPA-free, DEHP-free, latex-free, and ultra-low lint. The third medical device that Centervention has and distributes is the Swiper Medical Device Foam Wiper. The wiper is sterile, biocompatible, lint-free wiper designed to remove blood, contrast, and other contaminants from sterile instruments and medical devices such as guide wires, stents, and catheters. The Swiper has 93% less lint than cotton gauze or Telfa pads. Lint from cotton pads and cotton gauze and non-adherent pads can be transferred onto gloves, instruments, devices, air, and the patient. As previously discussed, this increases the risk of complications like inflammation, infection, and death. The swiper is durable, non-shedding, with one swipe cleans and hydrates with no lint left behind. It is highly absorbent and efficient. The swiper absorbs 20% of its weight in saline solution and transfers evenly to the medical device surface due to its open pore structure and conformability. It's effortlessly handling. The swiper is designed for easy, repetitive manipulation, conformable, yet maintains shape when wet and fits comfortably into any hand size. It's cost effective. It only takes 2 swipers or the typical amount of product used during a single procedure, managing less inventory to save on shipping cost, storage cost, space, and medical waste disposal. The features of the swiper are it's biocompatible, BPA free, DEH free, hydrophobic, lint free, low particulate, and it's been used in over 100,000 procedures. And this is my video presentation on strategic my video presentation for class Business 428.